Crisis is gripping the Golden State, and lawmakers, police, and parents all wondering what can be done to put a stop to it. When you look at the numbers, you can see almost 7,000 lives were lost to opioids in 2021. 83% of those were traced back to fentanyl, and 224 of those deaths were teens between the ages of 15 and 19. So everyone agrees it's a problem, but the solution has left lawmakers divided.
Yeah, joining us live to talk about this important issue, Dr. Bluthenthal, professor at the Keck School of Medicine at USC. Doctor, we're so thankful that you're with us this morning. We know that at the center of the divide, it seems to be this debate that goes back and forth over should we punish people or should we prevent in these cases? And I know it can be very tricky to know which way to go.
Well, I mean, the truth is that we have decades of experience with prohibition and punishment, and the conclusion is that it doesn't work. The crack penalties of the 1980s didn't remove the crack epidemic, and similarly, raising penalties on fentanyl aren't going to save anyone. In fact, we have good evidence to suggest that incarceration is a risk factor for overdose death, and in fact, if people feel like they might get arrested for fentanyl penalties, there's a chance they won't call 911 or administer naloxone to prevent overdose deaths.
Yeah, we've seen that debate kind of play out when they're discussing what to do about this. An estimated 110 Californians every week die of fentanyl-related overdoses. Those are just staggering numbers. Yeah. A lot of them we know are taking pills, are taking drugs they had no idea were laced with the drug. So two questions for you. First, what would the bills that moved forward actually change? And second, do the failed bills have a chance of being reintroduced later on?
Well, I'm not in a great position to talk about the specifics of the bill, so it's not something I track carefully. But what I can do is let you know that there are effective means for preventing some of these deaths, and that includes naloxone distribution, fentanyl test strip distribution, and also, most importantly, making the medications for opiate use disorder more readily available to people with substance use disorder.
You know, I find it interesting. I have friends who have lost loved ones in this epidemic, really. It's an emotional issue for many Californians. Obviously, when you look at the numbers of how many people are impacted by losing loved ones to an overdose, but you also have the underlying conditions for a lot of these people, mental health issues, they've had trauma in their life. To tackle some of those things is very expensive, and I think people look at the punishment aspect of this as an easy way to get these people off the street or maybe get some type of help, but then they just go right back, and if we're not fixing anything from the beginning, I don't know where this goes. Is there any science to show a clear way forward to handle this crisis? And how do we message this to people to say this is a worthwhile investment?
Yeah, well, let me first make the point that incarceration isn't cheap, right?
Yeah, that's true. Yeah.
It's actually very expensive, and you spent $20,000 to $30,000 a year putting someone in a cell. So if that money was spent on making mental health services available, opening overdose prevention sites, creating navigators to help people get through the healthcare system and get them mental health services perhaps that they need, we'd be all much better off.
We're expecting naloxone to be available for purchase over the counter starting this summer. This is a huge step forward, right? We know LAUSD has now put it in every school, including elementary schools. How do you think this is going to change the epidemic going forward, or will it?
Well, it helps with the probabilities if someone is having an overdose that there'll be a bystander or upstander around to administer naloxone to prevent overdose death. So it's a positive move, and I think the big issue with naloxone over the counter is just keeping the price down. We know that if you're charging $50, that will reduce availability, and it's a very inexpensive medication to produce. So hopefully the wider distribution will also result in lower cost per unit, which will increase the odds that someone has naloxone available when they witness an overdose.
Well, this has been an important conversation and one that we're going to have to continue. This issue isn't going anywhere. Doctor, we appreciate you coming on this morning.
My pleasure. Have a great morning.
You too. If you or a loved one is battling addiction, you don't have to do it alone. Just call 211 to connect to a network of free and confidential substance abuse and mental health programs.
It's not always a comfortable conversation to talk about, but it's a really important one to have.